Thank you, Mr. President. Mr. President, almost a year ago, as Republicans were jamming through the confirmation of Tom Price as Secretary of Health and Human Services, I rose to object to his nomination, and I voiced my very deep concerns about whether Secretary Price would be committed to protecting health care for our families, committed to putting evidence and sound policy over partisanship and ideology, and whether he would be committed to addressing the many ethical questions about his investments Republicans allowed to go unanswered. Well, he was not. Today, Secretary Price is infamous for two signature achievements. First of all, undermining health care access for millions of people, and second, resigning in scandal and disgrace. In the wake of Secretary Price's resignation, President Trump had another opportunity to get this right. I believe families in Washington State deserve a health secretary who will finally put patients ahead of politics. Unfortunately, after meeting with Alex Azar, hearing his testimony, and carefully reviewing his record and his qualifications, I do not believe Mr. Azar is an acceptable choice to lead the department, and I will be voting against his confirmation. From President Trump's first day in office, he has been focused on undermining health care coverage by putting up barriers to obtaining care, shortening our enrollment periods, expanding loopholes for corporations, and making every effort to throw the entire system into chaos. After a year of President Trump's healthcare sabotage, there were over 3 million people more uninsured in our country. So we need a voice to stand up and defend the health care that our families rely on. And I am alarmed by Mr. Azar's statements, cheerleading health care repeal efforts, predicting that the Affordable Care Act was, quote, circling the drain, even though enrollment stayed strong across the country this year, and detailing specific steps to, as he said, hasten the demise of patients' and families' health care. Now, meanwhile, while President Trump continues to call the opioid crisis a public health emergency, he has yet to treat it like one. So far, his administration has proposed cutting the budget for the Office of National Drug Control Policy by 95%. It's focused on gutting Medicaid, which provides critically needed substance use disorder treatment. And they failed to provide any new funding or resources to support the communities that are fighting this crisis. Local leaders in my home state of Washington and across the country need a voice at the Department of Health and Human Services, committed to bringing more resources, not fewer, to address the opioid epidemic. So I am alarmed by Mr. Azar's refusal to support more funding for communities who are hard hit by the opioid epidemic. President Trump's department has also shown a concerning pattern of undermining evidence-based policies in favor of ideology. When it comes to undermining evidence, political appointees at Health and Human Services have asked their career staff not to use the terms evidence-based and science-based because they view them as essentially meaningless. And when it comes to favoring ideology, not only has the department taken steps to restrict access to care for women and transgender patients, leaders have also sought to effectively ban the words like transgender and diversity and vulnerable among their department employees. Ban the words. And they've not just cut important words. They've gutted valuable evidence-based programs like the Teen Pregnancy Prevention Program. This program has provided useful insight on what works to address high teen pregnancy rates. It has been recognized by the Bipartisan Commission on Evidence-Based Policymaking for its rigorous approach to evaluation. And yet President Trump's administration chose to unilaterally shorten that program's grants. We need a voice there who will reject such damaging ideological decisions and to champion evidence and science and sound policymaking. I do not believe Mr. Azar is that champion. Quite the opposite, in fact. I'm alarmed that Mr. Azar believes a woman's employer should be able to decide, based on ideology, whether or not her birth control should be covered. I'm alarmed by his extreme and out-of-touch views on Roe v. Wade, as shown by his support for legislation and political candidates who would undermine the constitutional rights enshrined in this important decision, and his use of ideological rhetoric in discussing the rights guaranteed to women by that landmark case. Unfortunately, Mr. Azar is the latest in a string of ideologically driven healthcare appointees for President Trump. We cannot tolerate one more nominee overseeing a women's health care program who's more focused on undermining that than on advancing them. And finally, I'm alarmed by his track record at the pharmaceutical company Eli Lilly. As a nominee, Mr. Azar has said we need to fight to lower drug prices. But during his time as president of Lilly, that company tripled the price of insulin. And Mr. Azar personally approved significant price increases for dozens of the company's drugs. As a nominee, Mr. Azar may try to assure us that he will fight for patients and protect the health of our communities, but after looking at his record, after reading his past statements, and after discussing these issues with him, I'm alarmed he might not stand up for women and families. I'm alarmed that he might not stand up to the pharmaceutical industry. And I am alarmed he might not stand up to President Trump's agenda driven by sabotage and ideology. After months of Republicans putting politics ahead of funding health care for children, and as Republicans continue to put politics ahead of funding for community health centers like those in rural Washington state and those across the country that help to serve underserved communities, and as they continue to ignore other primary care programs that bring medical professionals to populations in need, like teaching health centers in Spokane, we have to have strong leadership at the Department of Health and Human Services that will demand that we put public health first, not partisanship. So I urge my colleagues today to vote against this nomination, and I thank the chair and yield the floor.